All right. So good afternoon, everyone. My name is Kyle Jackham. I am a licensed social worker and the program coordinator for Crossroads for Hope, formerly known as Cancer Support Community Central New Jersey. In partnership with Memorial Sloan and Kettering, we are happy to welcome you to Mental Health and Cancer, How a Diagnosis Can Impact You. Before we get started, I would like to introduce our organization, Crossroads for Hope. We are an independent 501c3 nonprofit organization located in Bedminster, New Jersey. Our organization helps all those touched by cancer to move through a health crisis, to become more active and empowered by taking control of their health and well-being. Our network of support embraces all people touched by cancer, the diagnosed and their loved ones, providing access to resources and evidence-based programs of support, education, well-being, and hope, and offered free of charge. We are committed to upholding the dignity of all people through respect for gender identification, sexual orientation, race, ethnicity, and income differences. Our vision is to be a safe space to turn to first for restoring one's whole being and improve the life of people with cancer and their families beyond the diagnosis. Our presenter today is Karen Dougherty. Karen is an adult nurse practitioner with over 13 years of experience in both solid tumor and hematological malignancies. Karen's current clinical focus is centered upon breast medicine and lymphoma malignancies. Karen is a graduate of the University of Pennsylvania with a master's in nursing with a focus on adult oncology. Karen is currently enrolled in Seton Hall University for her doctoral degree, expecting to graduate in December of 2021. Congratulations, Karen. Karen's current DNP project is standardization of initial chemotherapy patient education across a telemedicine platform. Karen is an active non-physician investigator in over 25 clinical trials. We welcome you, Karen, and I will hand it over to you. And once again, just please keep yourself on mute just to be respectful to our presenter as well as other attendees. And feel free to drop any questions or comments that you have in the chat box, and we will get back to them at the end of the presentation. Thank you for joining us today.
Good afternoon, everybody. It's a pleasure and a privilege to be here today to work once again with Crossroads for Hope. And thank you, Kyle, for that warm welcoming. It's really was such a privilege to be asked to come here and speak. Just knowing that the topic for this workshop is very near and dear to my heart, given the patient population that I deal with on a regular basis, especially in the breast medicine clinic, where I've laid down the focus of most of my career up to this point. I'm very much aware of the newly diagnosed patient from the perspective of them having this diagnosis presented to them and it causing much distress, anxiety, depression, and how we as healthcare providers can assist patients, whether they have an existing mental health or behavioral health issue prior to diagnosis, or the onset that comes associating to exacerbate the symptoms, as I mentioned. So this afternoon, what I'm going to do is I'm going to give you a brief overview of and let you know what the agenda is here. And at the end, I'll have a question and answer focus as well. So then that way we can touch on topics that are of interest to you, and I will answer them to the best of my ability. And if not, then I will get back with you, I promise. Okay. So what we're going to talk about this afternoon is the effects of a cancer diagnosis on mental health And then we're going to go into managing mental health consequences of this cancer diagnosis. And then we'll skip into the role of mental health providers in helping patients cope. We'll talk about some counseling. We'll give you some tidbits on managing stress with effective coping strategies. And we'll talk about support groups and how to collaborate with your oncology care team. And I have a list of resources as well. So let's get started here, and we'll jump right in. So we know that over a long period of time now, much research has been known and published regarding the fact that cancer causes excess mortality in those that already have existing mental illness and behavioral health problems. And so while the incidence of the rates have been found to be comparable between people with and without history of mental illness, cancer-related mortality is so much higher. And you can see why, because when you see what the physical impacts alone are when one receives a cancer diagnosis, in particular, you look at body image. You think about, oh my goodness, I have to have maybe a loss of a body part. I have to undergo chemotherapy, and I might lose my hair. What is the world going to think of me? And then you hear about things like treatment-related fatigue. We hear that it's cumulative. All of this can lead to insomnia. And so just the physical aspects alone can be really frightening, and they can cause much distress. So, research has shown us that emotional distress includes depression, anxiety. These things are not just on the day-to-day activities that one goes through when they go through a cancer diagnosis, but there's also the fear that of the disease in itself. There's fear that, okay, what if I get through this, and what if it reoccurs? What if I die? I have young children, and why me? There's anger. So all these things run through patients' minds as they're initially diagnosed. They'll say, gee, I'm not sure if I'll get the support from my friends and family. I don't look the same way. I might not act the same way. Many patients will tell us that I really knew who my friends were when I found out after I had my cancer diagnosis, because this is a very true and perceived entity where people will say, oh, I thought I would have support from this person, and now they keep such an arm's distance away. It's almost as if they're afraid they're going to catch this or catch something from me. So all of these things can cause such anxiety and depression. They also feel that maybe at some point their oncology team or providers will just give up on them, or they just won't get support from them. So all of these things we know can exacerbate pre-existing mental health issues. And we know that from research over the years that supporting people who have a mental illness around their cancer diagnosis is truly of utmost importance. And surrounding people with a holistic care component truly affects their long-term prognosis and their outcomes. So you heard me talk about anxiety and depression and distress, and let's just go over a little housekeeping you know, issue as to what's what. So what exactly is anxiety? Anxiety is, it's almost like being turned on. You feel nervous, you know, sometimes you feel a little edgy, worried, overwhelmed. You know, having a bit of anxiety sometimes is a good thing. It helps us focus sometimes, you know, and we know that it's normal. It's a normal response to anything that the body thinks is a threat. So, however, what happens when all of this goes into overplay? You know, then you think about your future, it's uncertainty, you know, so then you look at this and say, maybe this is you know, over consuming my entire being and my life. So then we know that, like, when anxiety goes on for a very long time, it makes us be able to not focus, not take care of ourselves. And then, you know, there's definitely a need that comes up, and we need to know that there are ways to reduce anxiety. And the other thing about anxiety is when individuals tell us that they're always anxious about something, you know, it paralyzes many, and it actually can cause individuals to have depression. So let's talk a little bit about depression. So depression begins with a feeling. To put it in the terms of, I just took care of my little 2-year-old granddaughter this weekend, my grandbaby, and she'd say to me, "Nana, I'm sad." And it so hit me when I was preparing for this, because she missed her mother, so she was sad. So, but that went away very soon as she found out that we had pretzels in the house. So, you know, losing interest in the things that you used to enjoy, you know, this is paramount in depression, where you just can't find the joy in the things that you would do, but you don't even want to do them. You know, going out, seeing your friends, you know, these are things that can come and go during treatment, after treatment. But we know that, like, you know, sometimes these things are temporary, and normal sadness does come and go throughout our lifetime span. But here we go. If we look at this and it continues to persist and it continues for weeks and weeks, this sadness and lack of joy can lead to what we call a clinical depression. So, like anxiety, depression can range from mild on one end of the spectrum to severe. Severe depression can affect how individuals go through their daily routine. Are they under eating? Are they overeating? Do they have an inability to take care of themselves? These are things that can affect your normal routine. So if individuals already have a pre-existing condition where they've been treated for clinical depression or anxiety, it's ever so helpful from the cancer care team's perspective for patients to let us know, so that we can help you get through your new cancer diagnosis and go through this journey together with you on this whole, cancer continuum. So that's really the most important thing that you can tell your care team there. So when you look at the effects of a cancer diagnosis on mental health, there's a study that was out from the National Cancer Institute, and they saw that individuals who have pre-existing mental health conditions exhibit the following. They'll say that 1 in 3 people with cancer experience mental or emotional distress. The most common is seen in the breast cancer population, and then in the head and neck population as well. Head and neck is those individuals who might perhaps have an oral cancer, sometimes called base of tongue, having a problem with their voice box. And when you look at these types of cancers in both the breast cancer population and the head and neck, the very frightening thing there right away is you look at body image. You know, like, will my loved ones still care for me the same way? How will they think about me? These are all things that can cause very significant mental and emotional distress. So we see that even in survivors, and you know, you all are a survivor from the day of diagnosis, okay? So 25% of those cancer survivors, that's 1/4, experience symptoms of depression, and up to 45%, that's almost half, experience some form of anxiety. Now, one thing I just wanted to say about these things is that oftentimes the highest level of anxiety is seen in the initial days of diagnosis. We see that because people just want to know what's going on, what is my stage, what is my prognosis, what do I have to do to go through treatment, what's required of me, what do I have to learn, and all of these things. Sometimes, you know, oftentimes in due time, we see that the anxiety levels initially perceived by patients tend to tamper down and are mitigated with ongoing education, sometimes an additional phone call from the clinic nurse or the physician. All of these things, once patients get a better handle on what's expected of them or what they have to go through, their anxiety level tends to lessen. So, but on the other spectrum, we also see that cancer survivors also experience many symptoms that meet the criteria for post-traumatic stress disorders. You know, we see that mostly in women, survivors, children who are survivors, come back and they'll say they've experienced nightmares, flashbacks, an inability to concentrate, inability to sleep, and sometimes it can lead them to skipping appointments. So we do know that there are, in particular, some risk factors. They can be, you know, physical, they can be previous trauma, somebody that might have a higher level of general stress. Also, people we see that have limited social support might feel that they are far more overwhelmed and experience symptoms that meet criteria for this post-traumatic stress disorder. So, you know, and if you've ever had a diagnosis of this before, it can definitely resurface under the cancer-related PTSD. So, you know, we also see that individuals who use incomplete or an inability to cope or with the use of avoidance, it causes them a lot of stress. And these are people that are more so found to be at risk to develop this. Now, the other thing I just wanted to mention is that I wanted to talk to you a little bit about the overall and arching effects related to suicide and cancer. Now, they do say that cancer survivors are twice as likely to die from suicide than the general population. However, there's some new data that's out there. Over the last 13 years, we do actually see a dip in this. And so while overall there are individuals who, because of their remorse, their depression, that they might feel that they don't want to go through the treatment, they don't want to be a burden on their family. There are people that contemplate suicide ideology. And, there are times when people are depressed, and always within the clinic, we always ask, are you having thoughts about hurting yourself? And we do take that very, very seriously. So, we can address that at another level after the class as well. So managing mental health consequences with a cancer diagnosis. As I mentioned earlier, it's the stress that comes from the cancer diagnosis, that can be so overwhelming. You're loaded with information. Your whole world just turns itself upside down within just a few minutes of when either that radiologist from where maybe a woman has that stereotactic biopsy that many times she, went back for more and more, imaging, and then finally they said, hey, let's do this stereotactic biopsy. And I'm not even going to talk to you about those who have undergone it, had said, how uncomfortable it is, and, laying there doing that. But when that radiologist calls you and says, gee, I'm sorry, Patty, we saw that your tumor is positive. Women will always say, I'll never forget that moment. Either they were driving in the car or, out somewhere at the store or with their kids or, wherever it might have been. They never forget that moment. Because from then on in, you just say to yourself, how is my life going to change? And it doesn't matter whether it's a breast cancer diagnosis or it's just any kind of cancer diagnosis. It's so impactful, that first phone call. So anyway, researchers they've examined the impact. We know that small group sessions offer strategies, and as our partner here at Crossroads for Hope has provided so many opportunities for patients to partake in these types of small group sessions that reduce stress, improve mood. They're life-changing. The individuals that people come across and meet, despite our scared and funny feelings about how we might die at some point, we do know that more and more people are living with their cancer, and they are survivors. So, needless to say, when you come across an institution like Crossroads for Hope, many women, men are telling us that they're making lifelong friends, and they're sharing their journey, and it's helping them move forward. Excuse me. So we know that results of studies show that breast cancer patients alone who participate in groups had a 45% lower risk of their cancer coming back, with a 56% risk of dying from their breast cancer, because we know that participation in such groups as this and having support lends itself to better outcomes overall. So in the National Cancer Institute retrospective study, there was something that was published in June of 2020, and they looked at 50,000 veterans treated for lung cancer at the VA. And these were people who were already living with mental illness, and they received mental health treatment, including that for substance abuse. And they found that veterans who received mental health care and support and received substance use treatment, they lived substantially longer from those who did not participate. And some of those numbers, the overall reduction in deaths from any cause from cancer was between 25 and 30%. And those who partake in substance use treatment, theirs was a reduction of 26%. Now, also there was housing support, and then some people partook in 20%, employment support, and their risk was 20%. So this was a very eye-opening study to show that when we look at support for people who have existing mental illness, that they do have better outcomes. So this was a truly an eye-opening study. So how do mental health providers help patients? What do we do for patients? So when we look at things like, Crossroads for Help, we look at, even at my institution at the big MSK, we know that the role of like the social worker, the psychiatrist, these are people that are an integral part of the care team. We know that they work with patients and their families to identify positive coping mechanisms. They can help manage stress. And one of the other things is to lessen and mitigate risky behaviors. So many people will say, well, I have a diagnosis now. I'm not going to live because now I have cancer. Well, I'm just going to go out and do my beyond daily drinking or smoking cigarettes or, taking different drugs that maybe I took in the past. But these are individuals, as the mental health provider, they are there to encourage an active and healthy lifestyle. So I just, to the right of the screen are just a couple of the ways in which they can do that. I was just going to touch on some of these, and I promise you we'll have some pictures on and have not just some white screen. We could look at mindfulness, relaxation techniques, cognitive behavioral therapy, stress management strategies, and I'll later on talk a little bit about medications. So there you go, picture, yay. So mindfulness, I do know that, places such as Crossroads for Hope, and we have much research going on at MSK about mindfulness and how these techniques can help patients. What is it? So mindfulness is a practice of focusing on your thoughts, emotions, and feelings in the present moment and with acceptance and without judgment. So essentially, it's a simple coping technique, and it can reduce stress, it can boost your energy, and overall improves your well-being. It's easy to do, it's easy to practice. You can practice it while, sitting in your car, walking, standing, going through your daily activities. It's easy to do. But the key is to focus on the activity at hand. Not necessarily that your mind is racing and you have to get to where you are, but, looking at like, oh, I'm taking my walk now and I'm outside on my, by myself, and I'm relaxed and I'm enjoying nature, beautiful seasons changing, etc. And the mindfulness allows us to step outside of our own minds and observe how we think about things and not just about like our cancer, but, you know, I have this beautiful opportunity to go and take a walk with my family and focus on the details of our experiences. And this really helps patients reduce their stress, it boosts their energy, and they feel better overall. So that's one technique. So this is one of my favorite pictures because I'm such a beach person. And it reminds me of the Outer Banks, being that that's one of my favorite places to be. So when I think about, you know, being relaxed or deep breathing, I think of like that ocean and, you know, that shoreline with the waves coming either very fast or very slow up to the shoreline. And these forms of relaxation techniques are available to help patients learn how to relax and reduce their stress. They can include mental imagery or visualization. Some include like muscle relaxation, you know, forms of meditation. There's biofeedback and yoga. All of these things are just fantastic techniques to put yourself in a form that is befitting of relaxation. So one of the things here, cognitive behavior therapy, I wanted to talk to you about a little bit. So cognitive behavior therapy, it focuses on the current situation and its solution rather than the past. So, you know, when you think about therapy, oftentimes you'll either see maybe you've seen a therapist, maybe you've seen a psychiatrist. You know, they'll think about all the things you drum up from the past and like, you know, why we hate our parents or, you know, who did this wrong to us and why we did this and that. But cognitive behavioral therapy focuses on the current situation. So, you know, it'll key into such points as concentrating on the person's, you know, views, beliefs, you know, about their life, but not necessarily their personality traits. So this form of therapy treats individuals to replace ways of living in ways that didn't work well to ways of living that work. So it's a way to incorporate a newness and a oneness. You often hear patients say that once they get their cancer diagnosis that they want to eat well, they want to focus on ways of being healthy, exercising. And these are all things that are so very important because overall, these are things that reduce the relative risk for cancer returning. So when you think about incorporating cognitive behavioral therapy, this is just one aspect of it in incorporating new ways to feel better. And we know that it gives people more control over their lives. Now, there is a little website here that you can look at, and actually, if you want to find a cognitive behavioral therapist, you'll be able to find that on that website. Okay. So I wanted to talk to you now about managing stress. So stress. I mean, at this point, stressors are the sources of stress. That's all I can say. You know, there are things that we have to do that with a cancer diagnosis that life goes on. You just, you know, you still have things to do. And some of the things that can cause patients the most stress is whether it's like, you know, their conflict with scheduling. You know, patients will tell us all the time, you know, I just can't fit it all in. You know, you want me to walk, you want me to do this, you want me to take time for myself. Yes, I should do that, but I have to work and I have to do this. You know, some people will find that going to work during this time period helps them deal with their stress because they don't have to think about, they have other things to think about as well. So, but other people find that this is far more stressful. So there's little, tips and pointers that people should, partake in it. Maybe having a daily, planner, put things on your phone, on a calendar. But one of the other things is just allowing plenty of time. Uh, you know, Incorporate that time into your day if you, can eat that better meal, go for that walk, give yourself enough time to get to your appointments. These are all things that help manage the stress, and also being cognitively aware of knowing what your limits are. If you don't have time to do something and someone asks you to do something, it's okay to say no, and not feel guilty. Whether it's your family, your work, if you've always been the person who's helped other people, this may be the time that to humble yourself and ask for help. So in order to do that, many have said that when you anticipate the task that you need help with, it helps to sit down and write a list, because, many times as people are diagnosed with their cancer or have recurrence, people come out of the woodwork and they want to help you. And even throughout COVID, we see that, like, people say, oh my goodness, you shouldn't be out there. Your counts are low. You could be in trouble, if you went into the store. Let me help you. Let me do your shopping. Let me bring a meal over. Take care of the kids. Take care of the pets. Take care of your mother. Do your mother shopping for you, which you always did. But when you anticipate those needs and think about the time that it takes to do it, sometimes one of the hardest things for patients to do is to let go and let other people help them. Prioritizing your tasks, making lists of the things you routinely do, such as, your household chores, rate them by importance. One lady once told me that her most important thing prior to doing chemotherapy was this. She knew she had to be there weekly, and each week she knew that she had a preconceived notion that because she vomited the first trip to her appointment, she knew she was going to get sick. And that's kind of anticipatory nausea. And even though in this day and age we have better medicines to work with that, I'm going back like 13 years ago. This one lady said to me, well, Karen, I can only throw up in a clean toilet. So she said to me, in order to do that, like this, what she'd say to me, my most important thing before I leave to go to chemo is make sure that my bathroom is clean. So she goes, but I feel so cruddy before I have to go. So she, had to humble herself and say, I'm going to have my friend come and clean my bathrooms before I go to chemo each week, every Friday. And she said to me, that was the only way I could get through that, because she said every time she got home from treatment, she would lay down on that floor and she knew she was going to be sick. And she knew that her friend took care of that for her, but she knew that she just couldn't get that done otherwise. And when she shared that to me, I was thinking about, well, that is one way she really managed her stress. And she said, I never would have thought I would do that. But she said, on the back end now, she said, I offer stuff like that to other people. And I help other people by doing things like that, because I know how important that was to me. So that really always made such a huge impression upon me. So, we always think about other things that stress us out, like, things happen throughout the seasons and they go on whether you have a cancer diagnosis or not. and things have to get done, and your kids have to be taken care of, or you're sandwiched in between, your parents need to be taken care of. There's always things that have to be done. And, if you figure that, oh, I'll just wait till it's my off week and I'll clean the whole house, then I'll feel better. And then it wears you out, and then you think about, oh, why did I do that? I could have been enjoying my family or my kids. So instead, like an example might be that instead of cleaning your entire house, then maybe tackle maybe just, the kitchen or one area, and kind of just do a little bit here and ask for help here or there. And by managing these stressors, they help. They truly help. So brings me back to avoiding the schedule conflict and, concentrating your efforts on things that you can control. But a stressor may be something you can't control or even change. And so one of those things, like I always talk about, is like with patients is like, for example, traffic. How about you try arranging your appointments not during rush hour? I know like many people at MSK would say, well, then everybody would want their appointment between 10 and 3 o'clock. So, it's hard to do. Sometimes you can't control that, but, if it's so much more stressful for you to drive 2 hours to go get your cancer care during rush hour, don't do that. See if you could change that appointment. So, these are just one aspect of managing stress. So, and then of course there's whether or not you're the breadwinner or not, there's help with financial burdens. So right now there's a new bit of verbiage out there called financial toxicity. So it's circulating through, even, Google research, et cetera. And, we see this in people who are undergoing cancer treatments because treatments are expensive. You have co-pays, your insurance isn't covering, you can't get your medication at this pharmacy, but only this pharmacy. Bills, they pile up, they can be late. All of this could be overwhelming. We always tell patients to, either talk to their social worker, talk to their financial advisor, talk to your patient financial services as well, where you're being treated. Because then this way it puts perspective in things, and it will help you manage the load of stress. So I do recommend that you see if you could get these things in order for yourself when you're feeling best. So that you're not spending hours on end doing it when you're feeling at your absolute worst. See if there's somebody that in your family that can help you with these things as well, because they are truly sources of deep stress, and they can really contribute to increased anxiety and depression overall. Okay. So I'm going to talk to you about stress management and how you could deal with these things. So overall, we'd like you to talk with a trusted friend, a counselor, a social worker. Schedule some time to relax. Spend time to do the things you want to do. Whether it's reading, gardening, listening to music, do things you enjoy. Truly, whether it's just taking a walk outside. Some people enjoy journaling. Writing about their stresses and events in their lives provides a way to express your feelings. And maybe you'll never open it again. Maybe you will. Maybe you'll share it with your kids. It's hard to say how that is, but some people do feel better once they put it down on paper. For those individuals who have now left their job to concentrate on wellness during their cancer journey. It might be a time when they're feeling better to learn a new hobby, take up something that they've never done before, an art class, learning to play a musical instrument. All these things are important. So I can't emphasize enough how to partake in these things, that how they will help overall. When patients exercise regularly, even something as much as moderate exercise, 30 minutes a week, they can lower their stress, they can help combat fatigue, stimulates your appetite, and it helps them sleep better. So these are all like cluster symptoms that happen for patients undergoing treatment. And just exercise a little bit alone. And you might say to me, oh my goodness, I feel so tired. All I want to do is take a nap. I'm so fatigued. But then when I take a nap, I get up and all I feel is even more fatigue. So sometimes it's just that starting of, going out to the mailbox the first day, walking out, coming back to the house, sitting on the stairs, doing it again the next day, maybe going a little further, doing it in the late afternoon. And you'll see over time that it can help. So, if it just means sitting outside, that can help relieve stress. Schedule your social activities. Working with the girls in the clinic, in the breast service, I always would say that, you're going to be treated every 2 weeks, and you're going to feel best the night before your treatment. Schedule that date with your partner. Go out, see your friends. Do that you're not going to feel any better than that day. Yes, you got to go out, you got to do it again the next day, but those are the things that you can look forward to. Schedule those social activities. They are stress reduction activities, okay? So eat well, maintain a healthy diet. If you're not sure about what's healthy, what isn't, talk to your nutrition team where you're being treated. Read up on some of these things, but talk to your team. We want you to get plenty of good sleep. Can you try for 7 hours or more? When you don't get sleep, you can't tackle the world the next day. It just leaves one with such an oppressive feeling. So these are individuals who might need a nap. But talk to your healthcare team about ways to manage your sleep. Okay. Another thing here is as we partner together with Crossroads for Hope is join a support group. You're here, and obviously taking part in these kinds of things is just one big step forward. But sharing and talking about your feelings and fears, it may help those people who share, because the shared experience is what you're going through. Maybe your family doesn't understand, but maybe somebody in your support group will, and you find comfort in that. Not everybody does find comfort in joining support group, but they do offer the chance to vent your feelings, and we do know that that is very helpful for many. So I wanted to just talk a little bit, go back to anxiety, depression. So, and as I circle back to this, I just want to go over the fact that, when you have anxiety and depression, it causes a lot of distress and suffering. And overall, if these are existing, it makes it harder to cope with cancer treatment. And subsequently, we find that those people who suffer from untreated depression and anxiety, they have trouble making choices about their care. They sometimes get paralyzed in their decision making. I had a woman recently that came, we were her 5th opinion And we finally sat her down and said, if you don't get treated now, the chances of your disease that will spread will lead to such a poor outcome. Can you please make a decision now and do what you're supposed to do? Please, take care of yourself. We had to be very firm with this individual because her lack of being able to make a decision is truly leading to her down the road to such a poor outcome that she may regret all of this in the future. So, well, I'm not going to talk about antidepressant medications specifically or anti-anxiety medications. There's many, many, many out there, but I do want to refer you to speak to your provider who may have already prescribed one of these medicines for you. If you are new to a care team, and you go forth and let them know that you're on a medicine, let them know that maybe perhaps during this initial time period, it's not being beneficial for you. You might not feel that it's working, so you might need a little something extra. These are things that we would hope that you could partner with your care team, with your existing provider, who is the initial prescriber, and let them know that you have a new cancer diagnosis, and that perhaps during that initial time period until things settle down and you understand how what the care plan will be, and maybe get a cycle under your belt if you're going to have chemo and things tend to settle down, then maybe you need a little something to help you along. So I can only say that with my utmost heartfelt ability is to speak frankly with your providers and let them know, because these untreated anxieties and depressions can only affect your daily relationships with your family and your providers, and it doesn't mean that an individual will be stuck on this medicine for the rest of their life. So we do see people that might ramp up their anti-anxiety medicines for a short time period, and then down the road they say, what, I think I want to do a dose reduction. I want to talk to my doctor about this and see how it goes. And they do come off of them. So that's why I think it's so important to be transparent with your care team and let them know how you're feeling. And we all want what's best for you as a patient, and we do want you to have the best possible outcome. That is my goal for all of my patients. That they're in survivorship mode and having productive lives, and with joy and and living with their cancers. Now, not everybody is in that situation, but living with cancer and having something with we treat it like a chronic illness for those individuals who have had their cancer return at later stages. But we do want people to have the most effective outcomes and have joy in their lives and be able to function well. And sometimes these medications are key. So whether it be from your existing provider, or if you need to see a psychiatrist either initially or more frequently during your initial cancer diagnosis or time of a return of a cancer, these things are really important for your overall well-being. So how can I get help? So I just, as I talked about just a few minutes ago, sometimes people feel embarrassed or they don't want to talk about their past. There's still, some people feel stigmatized by having had a history of behavioral health issues in the past. So, we always ask our patients, how can I get to know you better? What is it in your past that, we need to know about to help you get through your cancer diagnosis, for us to treat you so you can have optimal health. So, I always kind of phrase it that way, and patients will then say, gee, I'm so glad I could talk to you about this. But yeah, in the past I had this, I had a postpartum depression. I feel like I'm going to have something like this now. Maybe I should get some help. Yeah, that's the first step right there, is letting us know. And we are there, as health providers, health team providers, to help you get the right plan so you can have optimal health. So here's some resources, and you can look at these. I don't know if Kyle's going to be able to share these slides. I hope that he will. These websites here are very, very well done. They are rooted in research. They're evidence-based. They are not just like, many people run to the internet for things, but these are well supported websites, and all evidence-based. So they have a good reputation, and I hope that if somebody needs information about some of these things, they could go to it and get some good information there. I know they can, so this is why I recommend these. Okay, these are my references, and